We're a couple minutes after noon now, at least Mountain Time. So I'm going to go ahead and start getting started here and just provide an introduction as a few more people are joining on. So thank you so much for joining today for those of you that are on right now. We really appreciate you taking the time out of your afternoon to learn about this important topic. I'm Bree King, and I work at GBS as a senior population health consultant as a part of our health and wellness team. I'm also a certified wellness practitioner, and I'm super excited to be giving this seminar today about healthcare consumerism, which is our wellness topic for February. So I do want to state here with this topic that this is not intended to take place for open enrollment or answer employer-specific benefit questions or personalized billing or healthcare questions. But really the intent of this seminar today is to empower you to do your own research when it comes to healthcare decisions and to provide you with some tips and tools that you can use to make this a little easier moving forward. A few things to mention as individuals are joining. Everyone should be muted as you're joining this seminar. So if you do have a question, please feel free to type it in the Q&A, which is private. So we will only see those questions, but we will do our best to address them throughout the seminar or at the end. You can also raise your hand if you would like to speak, and we can unmute you at the end or during. The chat feature is disabled, so you won't be able to chat there right now. I'll also be doing a few polls throughout this seminar, so please engage in those and participate to make it more interactive. Also, as a follow-up to this seminar, we will be sending a recording out. We'll also be sending all the slides and resources as a follow-up, so anything that I share today, you'll have access to as a follow-up. Okay. So let's get started. Today's agenda just includes covering the definition of healthcare consumerism, and I'm going to briefly touch on some policies that apply to this. And then we're going to spend the majority of our time talking through 7 ways to be a smarter healthcare consumer. And then I'm going to close with some final tips and hopefully address some questions. So what is healthcare consumerism? Essentially, this is a movement that advocates for patients' involvement in their own healthcare decisions. So this pushes the healthcare system to provide better information and transparency, ensuring us as patients or consumers can make educated decisions about our health and health benefits. Especially with rising healthcare costs and inflation, it's really important that we as patients have a greater interest and need to participate in our care, in the care we pursue and what we receive, and our healthcare decisions. So we hope that this makes you feel empowered in joining this seminar and that you are able to take the driver's seat in your healthcare decisions moving forward. Okay, so a few policies to touch on. I'm just going to give you a brief overview of the first 2 as they apply to this topic. The first is the hospital price transparency rule. And this basically states that hospitals are required to publicly post 5 different standard charges now. And it also requires hospitals to provide patients with an out-of-pocket cost estimator tool. The second rule here is the transparency and coverage rule. And this requires health insurers or benefit plans, group health plans, to provide cost-sharing data to consumers. And what I want you to remember here is that you have access to a consumer price transparency tool from your insurer. So make sure to utilize that for cost estimations for covered services. And then the last portion here is the No Surprises Act. And this is a federal act that became effective in 2022. And it introduced new requirements for providers and facilities to protect individuals from surprise medical bills. So the first portion of this act protects us against 3 types of out-of-network surprise bills. The first is if you receive an out-of-network bill for an emergency service when you didn't have the time or opportunity to check if the hospital or surgery center was in network, you should be billed in network now. So you should not be receiving an out-of-network bill for an emergency service. The second thing that you're protected from is if you go in for an emergency or non-emergency surgery or procedure at an in-network facility, but a doctor that you did not choose, such as the anesthesiologist, is out of network. You should now not be balance billed for that service or billed out of network for that provider's role in your care. And then the third portion of this protects you if a life flight or air ambulance is needed. So you would be billed in network for that service now. And with this, I do want to state that this does not cover ground ambulance rides. And it also does not cover if you go to a different type of center that is not a hospital or a surgery center. So it does not protect you if you go to urgent care or any sort of facility. The second portion is the good faith estimates, and this basically means that providers and facilities need to provide good faith estimates of charges for care to uninsured and self-pay individuals upon them scheduling care. And then the third portion is the advanced explanation of benefits. And this basically requires health plans and insurers to provide an advanced explanation of benefits to covered members or patients for all services that are scheduled. And there's certain timeframes that apply. And with this, I do want to state that this portion of the Act is still pending and future rulemaking is expected just because we need more technical infrastructure to fully have this apply. Okay, so now we're going to dive into our first poll question. So we're going to ask everyone to participate here. And I'm going to give you a real life situation and example that happened to me. So my husband and I were out of town on vacation, and we were playing golf, and my husband dislocated his shoulder. There were some previous injuries and things that played a role into that. But anyways, he was in a lot of pain. He was, severely struggling, getting lightheaded. So we ended up taking him to the nearest emergency room. Which of the following are going to apply? And it seems like some of you have already answered, but A is if the ER was out of network, get ready for a massive bill. B, we should have called an ambulance to have him transported to the ER. C, because of the No Surprises Act, we should not be billed out of network and rather have in-network cost sharing, regardless of whether or not that ER was out of network. Or D, it would have been best to delay care until arriving back home. Tough luck, deal with the dislocated shoulder. So it seems like majority of people have answered so far. I'll give you one more minute. But the answer is C here. So thank you for paying attention to the No Surprises Act. And just some food for thought with this question is, would a urgent care have been more appropriate or the better site for care? A few things to consider. If it was out of network, that would not be protected by the No Surprises Act, which I already mentioned. And also if we did find an in-network urgent care, I did call to see if this would be okay to bring him in. And they recommended going to the ER because of the extent of the injury and the need for pain medication that they could not administer. So you can always call and ask as well. All right, so now I ended the poll here. All right, are we seeing my screen again? Hopefully. All right, so the next portion is the 7 ways to be a smarter healthcare consumer. And these are the 7 steps that we're going to walk through today. And the first step is to choose your plan. And so with this, I'm kind of making the assumption that if you have employer-sponsored benefits, you may have options to choose from. This may not be the case for everyone, but in general, going through some of this information is going to be helpful for everyone, or if you are trying to find a plan within the marketplace. With that, I highly encourage you to go to your specific employer open enrollment meetings, participate in online learning modules or online learning portals, read your benefit guides, click into those medical plan summaries to educate yourself. When choosing what benefits to elect and choosing your medical plan, think of this in terms to making another large purchase, maybe buying a new car, house, phone, even Amazon purchases. You're going to take the time to do your research, compare what's out there, look for cost-saving opportunities. I'm going to read reviews. So apply the same effort and time with your medical care decisions and take the time to educate yourself on what is being offered to you. For starters here, just knowing and understanding common insurance terms is going to help you select the right insurance plan. and utilize the benefits that are available under that plan. So I do want to mention with all of these slides, you'll see flyers linked here. So as you get the slides as a follow-up, you can click the flyers, they'll download. You should have access to more information on the topic that's on the slide. Same applies to the links that are going to be on some of these slides. You can click them, have direct access to all this information. Okay, so defining terms, I'm just going to start with premium. So premium is the amount an individual pays for insurance coverage, and this amount is typically reflected as a monthly cost. Your copay is that fixed amount that you're going to pay for covered medical services, doctor visits, or prescriptions. This commonly applies to traditional medical plans. A deductible is that specific amount that you are going to pay out of pocket each year towards covered medical care before your insurance company starts to pay. When your insurance company does start to pay, this is called coinsurance, and this is the percentage that will be paid upon meeting that deductible. Last is the out-of-pocket maximum, and that's a cap or limit on what an individual or a family will pay for healthcare services in a plan year. So a common decision that sometimes we are faced with when choosing between plans is choosing between maybe a traditional plan or a high deductible health plan. When choosing between the two, this is going to be a personal decision and really depend on your budget, if you have family involved, and how frequently you're going to the doctor. A few things to note is with traditional health insurance, you typically have copays until you meet that deductible. The deductible is going to most often be lower, and you're typically going to have a higher monthly premium. Whereas with a high deductible health plan, you're going to have to pay all the medical costs until you meet that deductible. And the deductible is typically going to be higher, but you are going to have a lower monthly premium because of this higher exposure. You also have the opportunity to use a health savings account with a high deductible health plan to offset some of those high costs and medical costs. And HSAs are triple tax advantage, so make sure to use an HSA if you do have a high deductible health plan. Some additional questions to consider when making this decision between the two is how much you've spent on healthcare the last year and premium, deductible, out-of-pocket cost. How frequently you go to the doctor, or if you have any new chronic conditions that you expect to be seeing a doctor more frequently. Also, if you're expecting any life changes, such as maybe having a baby, or even if you have young children that are entering school and you expect to maybe have more sickness than normal. So really, this should be a yearly decision, and you should assess what's going on in your life and not just assume that the plan you had this year is the best fit moving forward. One tool I found in doing research about this topic is a calculator provided from WEX, and that's WEX. And this is a high deductible health plan HSA versus traditional health plan calculator. And you can input some of your personal information there, and it can give you kind of a comparison between the two and guide you into what decision may be a better fit. The last thing I want to mention with this slide is just deciding between networks. So whether you have the option to choose between maybe like an HMO or EPO network or a PPO network or like a choice plus network. With HMOs and EPO, so exclusive provider organizations or health maintenance organizations, you typically or you need to stay in network with those types of plans, and you can only use the providers available in network. And typically your care is filtered through a primary care physician to help make referrals. Whereas in a PPO plan or a choice network, you have the freedom to choose your provider, and you can choose to stay in network or out of network, although going out of network is going to have higher cost sharing responsibility. And typically there's going to be higher premiums or higher deductibles with the PPO plans or choice networks. But a few questions to consider when debating between the two is just thinking if your current provider or providers are going to still be in network, if current medications will continue to be covered, or if you travel a lot and need access to out-of-network care. Okay, so second step is to actually maximize your benefits. So once you've selected what medical plan you're going to be on, make sure you're taking advantage of everything that is offered to you. And the first point here is to focus on preventive care. And preventive care services are typically covered at 100%, but make sure you are requesting a preventive care screening or visit as you schedule that so that it is coded correctly. And a note with preventive care is it is extremely important because we're catching things earlier on, we're avoiding chronic conditions down the road or higher cost to treat conditions. So really focus on preventive care. And with that, having an established relationship with a primary care physician can be extremely beneficial as it can help you create a personal care plan and discuss what screenings apply to you. And this can be different, maybe depending on your family history or personal health history. Some of those screening guidelines will still apply, but maybe you need to get a screening earlier, and your primary care physician can help facilitate those conversations. A good place to start, though, just to know what preventive screenings are recommended for you, is to use this My Health Finder tool. So I'm going to show you it right now, and just give me a second because I'm going to have to drag my screen here. All right. Okay, so I'm just going to show you how you would use this. So say I'm going to put in 30-year-old female. I'm going to click the results here. And it's going to show me what's recommended based on my age and sex. So it's going to tell me what screenings would apply for me. I can click on these links to learn more. It's going to give me some action items and things to talk with my physician about. It's also at the bottom going to give me some tips for healthy living or preventive care. So this can be a great tool to use, and it would give me different results if I put in a 60-year-old male, for instance. So highly recommend that everyone uses this as a follow-up just to know what preventive screenings are available to them. All right. Sorry, I'm just trying to get back to my screen here. Okay, so the second point in maximizing your benefits is knowing what other benefits are included within your medical plan. So that can be, condition management or disease management, any sort of wellness program, mental health benefit, such as like a digital online platform or employee assistance program, gym membership discounts, maternity management. There's a lot of benefits that can be included within your medical plan. And often these are very underutilized just because people don't know that they exist. So I highly recommend you to read the information that your employer provides to you and your benefit guides and such, but also do your own research and play around on your carrier website portal. See if you find any information that is not provided to you or that, any programs that have not been communicated to you. And if you find something helpful, share that with your employer, the HR team, in case they want to promote it to the population, as maybe you have found it helpful and they may not know about it. As often I mentioned, a lot of these programs are underutilized. And then the third point here is just knowing what other benefits are offered. So understanding if you have access to a HSA, FSA, I plan, any sort of healthcare advocation or concierge service, voluntary plans. Make sure you educate yourself and put in the same effort in understanding what benefits to elect and what benefits could be a good fit to you and your family. Okay, now we're going to do another poll question. So we'll pull that up. And this is going to tie into preventive care. So say you turned 45 last month, and it is now recommended that you go in for a preventive screening colonoscopy. Which of the following statements is true? A screening colonoscopy is a preventive procedure that is typically covered 100% by insurance for adults aged 45 to 75 every 10 years. It is important to make sure that you go to an in-network facility for a colonoscopy still. C, if a doctor finds a mass needing biopsy or finds a polyp, your colonoscopy may now be considered diagnostic, so you may be responsible for some cost sharing. Or D, knowing whether your colonoscopy is preventive or considered diagnostic isn't always simple. It's important to review your coverage or call your insurance provider before your colonoscopy appointment to better understand your coverage. Sorry, that was a mouthful. Or E, all of the above are true. So I'll give you a second if you need to reread any of those. I'd love to see what everyone thinks. All right, so I'm going to go ahead and close the poll. And the correct answer is E. All of the above are true. So make sure, you discuss your screening plan with a primary care physician, understand what is covered under your insurance benefit. And remember, even if you've elected to have any other sort of colorectal cancer screening, if they find something, you could still need to go in for a diagnostic service. All right, so now diving back in. Okay, knowing where to go for care. So first stop is going to be primary care, and this should be the first place or the first doctor we see for preventive, ongoing care, or an undiagnosed condition. And the goal is to establish a relationship and for them to provide referrals to specialists when needed. You can call your primary care for a sick visit, and sometimes they can get you in day of or next day. But if they cannot and your care is more urgent, the next best place to go could be urgent care. And urgent care is perfect for non-emergency situations that happen outside of normal business hours or when you can't get into primary care. With that, do double check the hours available at your nearest in-network urgent care. As they're typically not 24/7, they're more so extended business hours. But a perk to going to urgent care versus emergency room, typically they're going to have a lot less waiting time, more convenient locations, and are going to be significantly cheaper than the emergency room. So some situations where this may apply, having a minor fracture or break, sinus pain, flu symptoms, fever, and you need to get in outside of normal business hours. Also, remember that telehealth is an option. So for acute care, this can be a great option. So for instance, maybe pink eye, a urinary tract infection, flu or cold symptoms, sinus infection. Using telehealth can be much quicker and much cheaper. Sometimes it's even covered 100% by your employer. The next stop for emergency situations would be to go to the emergency room. And this is meant for, life-threatening conditions such as chest pain, difficulty breathing, stroke, head trauma, concussion, severe bleeding or severe breaks or dislocations, or for infants and young children who have high fevers or difficulty breathing, especially if they happen outside of normal business hours. So if you want to learn more about the difference between going to urgent care versus emergency room and what situations are going to be appropriate for the two, highly recommend you click on this link and learn more about that topic. The third point here is to educate yourself on outpatient service sites. And outpatient care is basically when a medical procedure or test can be done in a medical center without an overnight stay. So outpatient services can include wellness and prevention, diagnostic treatment, such as getting lab work done or MRI scan, treatment such as some surgeries or chemotherapy, rehab, whether that's drug, alcohol, or PT. And so for outpatient services, using a local hospital can be convenient and beneficial in some cases, but there are also advantages to using a non-hospital center or outpatient service site. Some of these advantages can be in quality, lower cost, less intimidation, and accepting more insurance. Also, they can provide more transparency for procedures. So definitely educate yourself on this topic, which leads into this next slide which is to shop around. And the main point here is that some doctors and sites for care are just much more expensive than others. So first reminder is to stay in network, and the second reminder is to utilize your specific carrier tools that are available to you, such as Find Care and Cost tool or a cost estimates tool. Use these things as they are available to you and free of charge. Also, I wanted to share this healthcare price tool that I found online. So once again, I'm going to share my screen here and pull up my web browser. Okay, so this is a free tool. It does have some limited functions with the free version. But for instance, if I wanted to look at hospitals near my zip code, just keep the zip code here, it's going to show me. Let's see if I can scroll down a little. going to show me just a comparison between, sorry, I'm trying to scroll down, a comparison between different hospitals in my area and what's overall going to be more expensive versus less expensive. So I invite you to play around with this and see if you can kind of navigate a more appropriate place for care dependent on cost. Okay, so the next portion here is using pharmacy tools to shop around. And there's two tools that I want to show you. So once again, I'm going to try and pull these up. The first is the GoodRx tool, and maybe you've already heard of this. But this is a great tool to find cheaper medications, to find the cheapest pharmacy for a medication, and to receive coupons for your preferred pharmacy. So I'll just show you an example here. Amoxicillins in my recent search history because my daughter just had to start amoxicillin for an infection. So I can type it in here what the prescription is and see where the cheapest place to fill that would be. And it can provide me with a coupon. And in some cases, this may be cheaper than your copay and cheaper than going through your plan. So definitely use this tool. This is a low cost example, but I've heard of some really significant savings from using this tool and even switching to generic by navigating with this. So now I'm going to share the Mark Cuban Cost Plus Drug Company information. So let me pull that up. And this company gives access to more affordable medications, whether you're prescribed a medication that's not covered by your insurance, or just don't want to pay the high out-of-pocket costs if you have a high deductible health plan. His company provides access to medication for the cost that the manufacturer makes them at, plus a 15% markup. So it's highly transparent, and there can be some significant savings here. So I'll just show you an example. So MS can be a high cost condition and have even higher costing generic medications. So if I were to look here, even if it is covered under my health plan, I can see my retail price for some of these generic medications is pretty high. And if I were to type it in here, it's going to be significantly lower. So definitely utilize this tool if you're on a high cost medication and want to know if you can access it cheaper. All right, and the last point is just to remember to check for quality. Don't ever sacrifice quality to get a significantly lower price. You want to make sure facilities you're going to are accredited and check for quality as you're shopping around. And this tool here is just going to show facilities that are certified with the Joint Commission, which is kind of like the gold seal for quality. All right, another poll question. So pull that up. Okay, so this is another real life example. We were out of town once again, and my daughter woke up and had a red goopy eye. Where would be the best place to get care for something such as pink eye? Would it be to wait to get care until we get back home, go to the nearest children's emergency room, go to the nearest urgent care, or to utilize telehealth provided by my employer or insurance carrier? And this could be assuming the urgent care is in network, but what could be the most cost-effective and convenient option? All right, I think majority have participated in this. And yes, the answer that I would specifically choose would be D, to utilize that telehealth that is provided to me. For the sake of convenience, I don't have to find somewhere to go, and for the sake of price. And they can typically write a script and you can go to your nearest pharmacy to pick that up. I could even use GoodRx to find the cheapest place to go to pick that up. All right. Moving forward. Okay, the fifth step is to plan for your visit. And this is extremely important. I know it can take time to prepare and make a list of questions, but if you don't make a list of questions, symptoms, concerns, prepare a list of your medications ahead of time, you can forget what you want to discuss at this visit. If you're like me, I know if I don't write it down and I'm there, I'm going to think of it in my drive home or when I'm laying in bed at night, and I'm going to be like, shoot, now I'm going to have to call back to answer that. So prepare ahead of time. This flyer linked here is a great resource. It gives you a lot of questions to think through before an appointment, also during an appointment. It gives you some questions that you can utilize. And the main point I want to get across here is that sometimes doctors don't prompt you to ask all the questions, and they don't always elaborate on things to the extent that you'd like. So remember that you as the consumer should feel empowered to question the services that are provided to you. So don't be afraid to ask why a test or screening is necessary, or if there's cheaper options for services, medications, etc. So definitely feel empowered to do that and prepare ahead of time. Also, this last link here just provides a resource for Don't Weigh Me card. So our GBS wellness team takes a health at every size approach. And so we think it's important for everyone to have access to equal care without stigma. So if getting your weight taken at a preventive annual exam causes you anxiety or prevents you from going in for care, check out this resource, as it can be a great tool to empower you to ask that your weight is not taken or not the focus of your care plan. This can also be a great tool if any individuals are dealing with eating disorders and it's not helpful to look at your weight. And we would love for care to be more focused on condition management and lifestyle behavior rather than just a number on the scale. It'll also state if weight is medically necessary, that maybe it's just not shown with you. Okay, the sixth step here is to act, and this is specifically focused at the end of your visit. So once you've gone, here's some things to think through. Make sure you're being proactive and taking the action that you need. So think about if you need to schedule a follow-up visit, if you can do it right then at that physician office. Can you schedule it so you don't have to worry about it later? Or are they going to provide you with referrals or connect you to the right specialist? Also, if you need any testing, imaging, or blood work done at a separate follow-up appointment, go back, shop around. Even if the order has already been sent, you can always call and ask that it is sent somewhere else. Same applies to prescriptions. If you had any test or health results screenings done at your visit, make sure you understand how to review these tests or health results. Is it going to be in an app or patient portal? Make sure you have access to that or have someone walk you through it if you don't have access, as this can be a great tool to use moving forward. Also understand if you should be receiving a call back to receive results, and understand what the timeline is going to be. And if you don't hear back, call them and ask. Even if you're not supposed to get a call back and you receive those screening results and have questions, it can be confusing. We don't all know what cholesterol levels mean. So feel empowered to call back and ask to speak to a nurse to review these results. If you received any recommendations for lifestyle changes, circle back to the benefits that are available to you. Do you have access to gym membership discounts? Do you have a certain amount of sessions with a registered dietitian available that you could take advantage of? Ask your provider if they have any recommendations. Utilize your wellness offerings. Just make sure that you turn these recommendations into action. And then the fifth point here is just kind of reviewing how your experience was. It's recommended that we evaluate our visit and provider and think about if we feel comfortable, heard, and respected with that provider. If we do not, we can choose that we don't want to continue care with them and seek care somewhere else. It's really important to feel comfortable and feel empowered to change if something feels off or you don't feel like you're getting appropriate care. The last point here is if you had the action to fill a prescription, our wonderful pharmacy team here at GBS helped create some points and things to consider when filling a prescription. I do want to point out that this can be a hot topic, and I am not a pharmacist. So if there are any specific questions, I'll do my best to navigate this, but this is more to give you general information and empower you to ask questions and think things through. This is a great resource here, this clinical corner. that gives you some additional insight in some of these considerations that I'm going to bring up. But first is just to think through any clinical considerations when you do or when you are first prescribed a medication. So make sure you're taking the time to review the goals of the treatment plan with your physician, understand how long this medication may be prescribed to you, and walk through any drug interactions. Make sure that that physician is aware of any current medications you're on, and ask about side effects. They may not be brought up, so make sure you fully understand what those could be and what the risks are. When it comes to cost considerations, I know I've already mentioned the GoodRx and Mark Cuban Cost Plus tool. So remember to use that, which I just opened that on accident. But also make sure you understand the coverage through your PBM or your pharmacy benefits manager as a first step. And you can find this information on the back of your insurance card. You can see what the RX company is and what the number is. If you have any questions, you can also check to see what the cost is going to be for different tiered medications, typically 1 through 4, if there's a copay that applies, or if they're going to pay a certain amount once the deductible is met. So make sure to educate yourself on this. Also call if you have questions when you are prescribed a medication and you're not sure if it's going to be covered. You can also discuss this with your physician. Remember that generic medication is going to be less expensive than brand name, but if brand name is necessary and appropriate for you and what you've decided with your physician, you can look for copay assistance programs. So even if the medication is covered and there's a high copay, you can search for this and see if the manufacturer offers any sort of coupons. Also, if you need to be on a medication that is not covered, you can look for that Mark Cuban Cost Plus tool, but you can also see if you qualify for manufacturer's patient assistance program, and your physician will help you fill out a form for this and walk through this, but you can get a discount or even those medications for free with certain qualifications for a year. But you do need to fill out this form and see if it's available with your manufacturer for specific drugs. And the last tip here is just to remember with your pharmacy, can you schedule automatic refills, get text notifications, do what's convenient for you, but make sure you're staying compliant with those medications. Also remember that you have access to the pharmacy for counseling and education. Okay, last poll question. Okay, so say you've been prescribed a new medication by your provider. Which of the following statements is for sure going to be true? This is a bit of a tricky one. A, your physician will make sure that you are getting the best price for your prescription. B, your physician will review all potential side effects of that medication as well as any current medications you are on to check for drug interactions prior to prescribing that medication. C, even if you have health insurance, it may be cheaper to use a coupon on GoodRx to order a medication from the Mark Cuban Cost Plus drug company. Or D, all of the above are true. It looks like a few people are still answering. All right, I'm going to go ahead and end the poll. So the correct answer that I'm looking for is C. So remember to use those cost-saving tools, as they may give you a cheaper option than going through your insurance, or just help you find a cheaper pharmacy to pick up that prescription. But with A and B, this can be the case sometimes, but not always. So you as the patient should be empowered and do your homework to ask these questions and provide your physician with a list of medications, things like that. Okay, the last step here. It looks like someone's raised their hand. Okay, so we can pause really quick and allow Dawn, if you had a question. Let's see. Feel free to unmute. I'm trying to unmute you now.
Hi, thank you. I just had a quick question on the website you mentioned. Was it to compare your traditional with the star plan, or the traditional to the high deductible plan? Was that WEX, WEX?
Yes, WEX. So WEX, and we can provide that in the follow-up email as well. But yeah, taking a step back, that was when comparing your plans, that was just a tool that may be helpful for some individuals to use, and we'll provide that.
Thank you.
You bet.
And Don, I put a link in there on your question to their benefits toolkit.
Oh,
So
thank
hopefully
you
that
so
will
much.
help you find that.
Awesome.
And Bree, there's one other question while you're paused. Do you want to answer a couple questions, or do you want to finish and then answer these questions in
Let's
the
see. Okay, we have one more slide. So I'm going to go through that last slide just with the last tip, and then we'll get to questions. I know we're already running short on time. So I'll be really quick on the next slide, and then we'll start addressing some questions and end with that. Okay. So the last slide is just post-visit reminders. And this is just talking through the difference between an explanation of benefits versus a bill. So the explanation of benefits is going to be sent from your health insurance plan once the doctor's office sends a claim and or bill to your insurance company. So that's going to outline what portion of the bill is going to be covered by your insurance, and then you will be billed from the doctor's office for the remaining portion. So a few tips: save your explanation of benefits until you receive the final bill, compare it. Also remember, you may receive more than one EOB if you had more than one type of service or treatment or multiple days of treatment. Once you do receive that bill, make sure you fully review it and look through the dates, providers, procedures to make sure it's all correct. So you can be provided an itemized bill if this is not already available to you. And if there are any red flags, make sure to not just pay this and take the time to call and ask. And look through if the bill is extremely old. Make sure you didn't already hit your deductible. You can always ask for bills to be rebilled. If you need help disputing a bill, hospitals and providers may have someone that can assist with this and help you. Remember, you can do a payment plan, interest-free typically. And also, you can always ask to receive a discount if you're willing to pay for a bill up front. Sometimes you can receive up to a 20% discount by being willing to pay that. Last thing, remember with the No Surprises Act, if you have been billed out of network, it was for an emergency visit, you can always file a complaint or call the No Surprises help desk. And then last point, I said last point, I know, but remember to submit for any reimbursements or credits. If you have a wellness program, see if you can get points or incentives for doing preventive care. Also, if you have voluntary benefits, remember to check to see if you can do a well visit claim to receive some money back with some of those accident plans. Okay, with that, closing with just a few tips. Create a routine for preventive visits, schedule this, align it with your birth month. That can be helpful. Keep copies of records, whether that be paper or electronic, just to prevent against duplication of care. Make sure you're aware of your family history, personal health history. One app I would recommend if you want immunization records is the Docket app, and that's DOCKET. And this can give immunization records for like your kids entering school or if you travel a lot. Also, make sure you download and know how to use your patient portal or healthcare patient app, as well as your carrier apps, as they can house a lot of great information all in one place. And this can be where you can store some of your electronic health records. Also take a picture of those carrier insurance cards in case you can't access the app or don't have the hard copy on hand. And remember that for prescriptions, generic is typically going to be less expensive, and utilize those cost-saving tools when possible. So with that, I know I was a little rushed at the end, but I do want to address questions if we can. So let's start filtering some of those.
So Bree, I can read these to you if that's easier.
Yeah.
So first question is I've heard once you get your itemized bill, for example, after having a baby, you can ask for discounts or reduce the out-of-pocket cost. Are there resources we can use to prepare for that conversation, or any tips that you'd recommend?
That's a really great question. I can't think of any like question prompts off the top of my head or resources, but we can check to see if we can provide some tools for that. As I mentioned, if you just call and ask about that sometimes you can get a discount just by advocating for yourself. Some of our tools provided in like questions to ask your physician, I'll have to double check to see if they offer any sort of prompts. But if not, we can do some research and see if there's some tools we can help provide you with or online resources that can help give you some questions to advocate for yourself.
Perfect. And then the other question, this is a little bit more insurance company specific, but so maybe you'll be able to answer it more generally. Where, specific insurance plans you'll have to check with your provider, but I heard that PEHP does not support manufacturer patient assistant programs, or they don't count towards our out-of-pocket. Is that true? Or just in general, manufacturing patient assistant programs for meds, for pharmaceutical things? Do you know on that?
I'm not positive. I'll be honest here, especially with PHP. I don't know for sure what's available there. With manufacturer assistance programs for prescriptions, typically you're using them if they're not covered. So I think that would be the case, that what you're paying is not going to go towards your deductible. But I don't want to say that's 100% true for every situation. So we can confirm with our pharmacy team and provide that as a follow-up as well. Or I would recommend that you call your PBM and speak to them about your specific medication and help them navigate and help you navigate that question. Sorry, I don't have a for sure answer on that one.
And that's all the questions. If anybody else has them, you can either raise your hand or throw them in that question answer chat. Oh, looks like one just came up. Do you have any tips on how to navigate a catch-22 situation where a provider cannot confirm coverage of a service until you agree to it and they actually bill insurance?
Let me think through that. Do you have any tips on how to navigate catch-22? I do not know for sure on this question either. We will keep these questions and see if we can provide some answers as a follow-up or some resources to help with that. Yeah, feel free now if you would have any questions, or if you have any tips that have not been shared or like savings that you've found. We'd love to hear from you, as I know we all have our own personal experiences. So feel free to share any tips that you have as well, if anyone wants to unmute themselves now. And once again, we'll do our best to address some of those questions that I didn't address live here. And feel free to type those in too, and we can take those as a follow-up if it's a more personal question. Well, we will stay on for a little bit if anyone does have any questions that did not get addressed and they'd like to ask. But if not, we really appreciate you taking the time this afternoon to join the seminar. You're always welcome to email our wellness@gbsbenefits.com email if you do have any follow-up questions. We will send all these slides and resources as a follow-up. As well as the recording. So feel free to share that information or review as you need. But thank you once again, and hopefully you've received one tip or tool that you can use moving forward.